In the heart of Liverpool, a city defined by its resilience and maritime soul, stands a monument to a different era. HMP Liverpool, known to generations of locals simply as Walton Jail, is woven into the very fabric of the community. Its red brick walls and Gothic turrets are as much a part of the skyline as the cathedrals and the Liver Building. But this is no tourist landmark. It is a working institution, a place of confinement that has cast a long shadow over this part of North Liverpool for more than a century and a half. From the outside, it looks imposing, a fortress of Victorian certainty built to intimidate and contain. Its architecture speaks of an age when punishment was a public spectacle, and justice was etched in stone and iron. For the thousands of people who pass by its perimeter every day, it is a constant, silent presence, a reminder of the complex social realities that exist just beyond the high walls. But inside, this relic of the past has become a symbol of a modern crisis. In recent years, HMP Liverpool has become one of Britain's most criticised prisons, a focal point for concerns about the state of the entire penal system. This is the story of how a prison built to embody order descended into chaos, and the monumental effort to pull it back from the brink. Opened in 1855, the prison is one of the oldest still in use in the United Kingdom. It was designed according to the principles of the separate system, a philosophy that championed solitude and reflection as the path to reform. The radial design, with wings sprawling from a central hub, was intended to allow for total observation and control. Every brick was laid with the purpose of enforcing discipline. But the world that built HMP Liverpool has long since vanished. The philosophies have changed, the population has soared, and the building itself has been pushed far beyond its intended limits. Its age has created serious, systemic problems. The very bones of the building are tired. What was once a marvel of Victorian engineering is now a crumbling liability. The infrastructure is a patchwork of fixes and temporary solutions, a constant battle against decay. Cells designed for one man in an era of solitary confinement are now routinely holding two. They are cramped, poorly ventilated, and offer little privacy. The proximity of a bunk bed to an unscreened toilet is a daily indignity that erodes morale and basic human dignity. For up to 23 hours a day, this small confined space is a prisoner's entire world. Elsewhere, facilities are outdated and failing. Communal areas, from showers to association rooms, show decades of wear and tear. The plumbing and electrical systems are a labyrinth of aging components, prone to frequent and unpredictable failure. Maintenance is a constant, relentless struggle. For every problem fixed, another two emerge. Staff spend a disproportionate amount of time and resources simply trying to keep the building habitable, patching leaks, restoring power, and unblocking ancient pipework. It is a Sisyphean task that diverts attention and funding from the core purpose of rehabilitation. In recent years, official inspections by His Majesty's Inspectorate of Prisons raised increasingly serious concerns. Reports painted a grim picture of a prison in steep decline, where the cumulative effect of neglect and under-resourcing had created an environment that was not just unpleasant, but dangerous. Violence, both between prisoners and against staff, increased to alarming levels. The combination of overcrowding, boredom, and the widespread availability of illicit substances created a volatile and unpredictable atmosphere. Assaults became commonplace, and for many, fear became a constant companion. Drug use, particularly of new psychoactive substances like spice, became widespread. These potent and unpredictable chemicals fueled debt, bullying, and serious health emergencies, placing an enormous strain on staff and healthcare services. The prison's ageing infrastructure, with its countless crevices and vulnerabilities, made it incredibly difficult to stem the flow of contraband. As the situation inside deteriorated, staff numbers fell. The challenging and often dangerous working conditions led to high rates of sickness and attrition. Experienced officers left, and recruiting replacements proved difficult. This created a vicious cycle. Fewer staff meant a less controlled, more dangerous environment, which in turn made it even harder to retain and recruit officers. With a depleted workforce struggling to manage a large and complex population, basic safety was compromised. The ability to maintain order, respond to incidents, and deliver a meaningful daily routine was severely undermined. The prison was operating on the edge. Inspection reports described appallingly squalid and filthy conditions. Communal areas were dirty, rubbish accumulated on the wings, and a general air of decay and neglect pervaded the establishment. Broken windows, often left unrepaired for long periods, exposed cells to the elements, making them cold, damp, and even more miserable. The sound of the wind whistling through shattered panes became part of the prison's soundscape. The decay attracted infestations of rats and cockroaches. The presence of vermin was not just a sign of poor hygiene. It was a profound psychological stressor for those forced to live and work alongside them, a daily reminder of the squalor. The inspector's verdict was damning. They found hundreds of cells that were unfit for human habitation, plagued by damp, mould, and broken fixtures. The conditions were described as some of the worst inspectors had ever seen in a British prison. Against this backdrop of physical decay and rising violence, healthcare and mental health support services struggled to cope. The sheer volume of need, from treating injuries from assaults to managing complex mental health crises and substance misuse, overwhelmed the available resources. In an environment of hopelessness and fear, self-harm incidents rose dramatically. For many prisoners, it was a desperate cry for help or a way of coping with the intolerable pressures of their surroundings. Each incident represented a personal crisis and placed further demand on already stretched staff and medical teams. Tragically, the crisis also saw an increase in deaths in custody. Each death is a profound failure and triggers intense scrutiny, prompting difficult questions about the duty of care owed to those held by the state. The rising number at HMP Liverpool was the most serious indicator of a system in crisis. In response to the escalating crisis and a damning inspection report, the Ministry of Justice was forced to intervene. Emergency measures were introduced to stabilise the prison and begin the long road to recovery. The situation was deemed so severe that it required an unprecedented level of external support. Additional experienced staff were deployed from other prisons across the country. This injection of manpower was critical to restoring basic order and safety, allowing the prison to regain control of the wings and re-establish a proper daily routine. A massive program of cleaning and repairs was accelerated. Teams worked around the clock to sanitize cells, repair broken windows and fixtures, and tackle the infestations. It was a physical manifestation of the attempt to turn the tide, to bring light and cleanliness back to the darkest corners of the prison. The prison's senior management was replaced. A new interim leadership team was installed with a clear mandate to drive rapid and sustainable improvement. This change signalled a recognition that a new approach and a fresh perspective were essential to address the deep-rooted cultural and operational failings. In the months that followed, there were tangible improvements. Subsequent inspections noted a significant reduction in violence, better living conditions, and improved staff morale. The prison was cleaner, safer, and more stable. But despite this progress, fundamental challenges remain. The story of HMP Liverpool highlights the staggering cost of long-term neglect. The emergency intervention required a huge investment of public money and resources, funds that could have been spent on proactive rehabilitation rather than reactive crisis management. It demonstrates a difficult truth about our public services, that ignoring problems doesn't make them go away. It just makes them more complex and expensive to solve. The crisis was a perfect storm, the inevitable result when chronic overcrowding meets aging, dilapidated infrastructure. When a system is asked to hold more people than it was ever designed for, in a building that is physically failing, something has to give. In these conditions, control begins to fail. Not just the physical control of the environment, but the control needed to deliver education, work, and rehabilitation. The very purpose of prison, to reduce reoffending, is undermined when the system is consumed by the simple act of survival. And when that happens, it is the prisoners, the staff, and ultimately the public who pay the price. The failure to provide a safe, decent and purposeful regime has consequences that extend far beyond the prison walls, impacting families, communities, and the very notion of a just and effective penal system. The challenge now is to ensure the lessons of HMP Liverpool are not forgotten, and that the recovery is not just a temporary reprieve, but a permanent change. Subscribe to Unknown Record for deep, untold UK stories.